I would like to introduce Janet Gomez. She is the Network Development Coordinator who will briefly describe what Torrance Memorial Physician Network is. And with that, Janet, I welcome you.
Hi, everyone. Welcome. As she said, my name is Janet. Thank you all for joining us today. Just before getting started, I wanted to very briefly go over us, Torrance Memorial Physician Network. We are a multi-specialty medical practice. We're committed to excellent service and striving for great experience. In a nutshell, we are an integrated health system. By sharing the same EHR, the electronic health record, with all three entities throughout the health system, we can provide greater quality care coordination, access, and quality care. To learn more about us, please feel free to give us a call at the number on your screen or visit our website at temphysiciannetwork.org. With that said, I'd like to introduce our speakers for today. We have Dr. Ruhi. She is she specializes in internal medicine. She's located in Torrance, and she will be discussing polypharmacy. We have Dr. Mejia, who specializes in family medicine and sports medicine. He's located in Hermosa Beach. He will be discussing the importance of fitness and endurance. Lastly, we have Dr. Shohan. She specializes in family medicine. She practices out of Manhattan Beach, and she will be discussing preventing falls. Without further ado, I'd like to introduce our first speaker, Dr. Ruhi. Thank you.
Good afternoon, everyone. I'm Dr. Neda Ruhi. I am an internal medicine specialist, and my focus in practice is for geriatric population. Thank you for joining us, and I'm going to talk about polypharmacy in geriatrics today. So the question that I get a lot in my practice is, what is polypharmacy when I talk about it to my patient? So the definition of polypharmacy is when presence of multiple disease or conditions, which we call it multimorbidity, associate with use of multiple medicines, which is polypharmacy, and is very common in older population. However, there's no consensus definition for polypharmacy. WHO defined this term as administration of many drugs at the same time, or administration of excessive number of drugs at the same time, which WHO suggested a threshold of greater than 5 medications per day, but quantification of polypharmacy remains controversial between physicians. And as I said, multimorbidity increases with age, and which then increase the consumption of medication, and the risk of polypharmacy, of course, increases. How can we prevent polypharmacy, and is it something that we can prevent or not? So this is very important topic, and it's the clinical challenge in older adults. And assessment of daily drug consumption by elderly population is, and the relationship with them is very important. First-line health services, which are doctors, nurses, medical assistants, ER doctor, have a crucial role in monitoring and preventing polypharmacy. But one common issue is medicine consumption without prescription, which is very common. One study in Turkey showed that only 52.6% of consumed medicines had been prescribed by a physician, while 21.1% were taken based on the patient's own decisions, and 13.2% was due to a friend's advice, 7.9% was due to a pharmacist's advice, and at the end, 5.25% was due to a neighbor's advice, which of course is different in different culture, but this is very common in the population. And what is the harm of polypharmacy? So polypharmacy increases the likelihood of adverse drug reactions, drug-drug interactions, delirium, which is acute change of mentation, fall, and other negative outcomes. So what are the risk factors for polypharmacy, and what is the risk factor that's causing polypharmacy? So it divides to two categories from patient standpoint and healthcare system. So patients who are the age are more than 65, or they have any cognitive impairments like dementia or any developmental disability, or their friability and lack of primary care physician, or any mental health condition like depression, anxiety, and also seeing multiple subspecialties by patient. And chronic conditions are the factors from patient standpoint. But what is important in healthcare system to consider for polypharmacy is poor medical record keeping is very important. It's very important to have a good medical recording, and we can keep a track of everything. So, and also from transition of care is very important. When patient hospitalized and then when patient discharged from the hospital, it's always good to have this transition of care from hospital to the primary care or any subspecialty physicians. And the use of automated refill system is also plays a role here. Sometimes the pharmacy or patients request for refilling medication, which they don't even need to take, and this automatic refill with patient, when providers get it, they don't have enough time to go over all the history that patient has, why this patient is taking this medication, and this automatic approval caused a problem. So prescribing to meet disease-specific quality metric. What does that mean? Sometimes based on the guidelines, based on the studies, all of those, the studies suggest, okay, it's better to take certain medication based on the medical condition that patient has, but we always better to consider the age, medical condition, and based on the patient to patient is different to consider the medications. So it's better to always communicate with your primary care doctor about simplifying your medication list. So every time you go to the primary doctor, it's better to ask them about the medication that you're taking and tell them to, simplify for you what are these medications for and why you are taking this medication. And you also need to report them if you are taking it or not. So why geriatric population are more at risk of polypharmacy? This is very important. Why the younger patients are not at that risk. So elderly are more at risk because of physiological change in their bodies. So they are more sensitive to benzodiazepines. What are benzodiazepines? Or like Xanax, Ativan, lorazepam, diazepam, all of these medications are the group of benzodiazepines. And analgesics, which are the pain medications and also blood pressure medications. So the other factor is reduction of kidney and liver functions, because the liver and kidney are not functioning well. So it's harder for them to excrete the drugs, and the drugs remain in their body longer. And the other factor is reduced body fat. How that works, because it plays a role in distribution of drugs in the body, and because they have less body fat, so the change happens in distribution of the drugs in their body. And because of the medical conditions that they already have. So patients who have dementia are more at risk of having delirium. So it's as I said, it's change of mentation, which happens acutely, and it may be even just a simple medication that if younger patients take, nothing's gonna happen, but for them, it caused delirium for them. So they have poor kidney function, which can cause like CHF, congestive heart failure, or the poor balance that they have causing fall, or because of the reduced baroreceptor reflex causing orthostatic hypotension. So what is orthostatic hypotension? When you change your position from when you are laying down, you want to sit down, and then you want to stand up. So when you change your position, when you are younger, so your body adopts faster and nothing is going to happen to you. But when you're older, so this reflexes is kind of delayed. So when you change your position, there's a delay for blood to circulate in your body and brain, so you feel lightheaded, dizziness, and it increases the risk of fall. So with interviews with general practitioners, these are something that brought up by them. So why this might happen in elderly. So one factor is side effects are not always recognized. So, and it's difficult to keep an overview of the exact medication they are taking, because sometimes patients are self-medicating themselves, and sometimes the compliance is not good. For example, the prescription is prescribed already by a physician, but they are not taking the amount that they need to take. So the physician thinks, okay, they are already taking this medication, and blood pressure, for example, is not still under control, so they increase the dose, although the patient is not taking even that dose, so it increased the risk for patients. And sometimes it's difficult to get people to stop medications, so you need to kind of convince them to stop medication. It's not good for you. It's better to take less medication. And sometimes they feel pressured, the physician feel pressured to prescribe, as I said, because of the guidelines. So, but the guidelines is not specifically for a specific age, and it's in general. So sometimes it's not good to take it serious for the elder patient, because it might harm more than benefit for them. And also sometimes other prescribers are involved, so they are reluctant to change it. Okay, so what is prescribing cascade? So prescribing cascade is when patient develop symptoms. So patient have a symptom, they tell the provider about it. So provider start prescribing a medication, and that medication itself cause signs and symptoms, sometimes side effects, sometimes no. That's the how the medication works, when, especially at the start when they just started medication. So and patient tell the physician, okay, I have this symptom, so again another medication starts for controlling that specific symptom, and it goes on like a cycle, and it causes harm. As you see here, an adverse reaction, drug reaction, is interpreted as a new disease, and the new medication start. Again, that new medication cause another symptom, that it goes on and on. For example, how did Mrs. A's prescribing cascade happen? So patient Mrs. A had AFib, so they started metoprolol and warfarin for her. And then husband died, she wanted something to sleep and helping her for anxiety, and the lorazepam start. Then 3-5 years ago, then knee pain started, ibuprofen starts, then ibuprofen usage caused high blood pressure, ramipril starts, ramipril caused cough, then another dextromethorphan starts for that. So it goes on and on and on, and the medication, instead of adjusting medication, medication added to a previous medication. So what are the steps that it needs to be considered by physician and also by patients? So it's always good to know when to stop and when to taper off slowly. So it's always good to involve your provider for decision that you're making about the medication. If you're considering to stop a medication, or you don't want to be on medication, or that medication causing some side effect in you, other than rather than stopping medication by yourself, it's better to talk about it with your provider to make a decision together about it. So what is best for you? Is it good to change it with other medication, or is it good to stop it, or how the physician can help you? And it's always good to involve the team members like nurses, social workers, physiotherapists, occupational therapists, all of that. And always it's good to include non-pharmacological approach for patients. And always it's good for older patients to get the family involved, so they are aware of the situation. How to prevent polypharmacy in elderly patients. So this is our main point here. So pharmacists can have a powerful impact on patients' outcome through medication management. So medication management can include a number of services, from performing assessment to communicating with patient's primary care provider. How that happen? For example, PCP or any other doctors prescribe a medication for a patient. So pharmacists get the prescription and they can always communicate with physician. For example, this patient is not already taking this medication that you prescribed before, so you're adding a dose, although patient hasn't started the previous one still, or other, maybe the allergic reaction that they had in the chart and they know about it from the patient, so they can always communicate it, communicate with patients and also providers. So the combing through the patient's record can help identifying common polypharmacy problems, how that happens. For example, sometimes when we check the record from the patient, medication are used problem, which may possibly prescribe two or more and accept, and it goes through and patient is taking that medication which maybe hasn't needed. So this is for acid reflux is very common. So in summary, conduct medication reconciliation at care transition is very, very important. So which means when patients are hospitalized and then they discharge from the hospital, it's always good to follow up with your primary care doctor to go over your medication and whatever they have done in the hospital to see which one you need to continue taking and which one you need to stop. And it's very important, this transition of care for the patients. And that way they can eliminate duplicate medication that you are on. They can assess drug-drug interaction. They can review the dosage of the medication that you're taking based on your kidney function, your liver function, all that. So doing so, they can reduce the incidence of polypharmacy. They can ensure patient safety. They can reduce the hospitalization and decrease associated costs. Because if all that happen, and again, because of the drug reaction or because of the duplication of the medication, they can develop new symptom, and again hospitalization and all that happens. So we as a primary care provider can take care of it. So it's always good to communicate with your primary care physician and have a routine follow-up for your medication refill instead of just sending the request for refilling your medication, to go over all that to see which one you need to take, which one you need to stop, which one you don't need it anymore, and then we can prevent polypharmacy together. Thank you so much for your participation and stay healthy. Have a great day. Dr. Mejia is next presenter.
Hello, everyone. Let me pull everything up real quick. Oh, I apologize for that. I guess we're at the beginning of the screen, so I'll go forward a couple. Again, I apologize for that. Good afternoon, everyone. My name is Matthew Mejia. I'm a physician here at Torrance Memorial, focusing in family medicine and sports medicine. Thank you for taking some of your time today to watch these lectures. So we're going to be focusing on physical activity and why is it important today. So there's some consequences of why is it so important? What are the consequences of just kind of, just sitting down, not being very physically active? Well, as you can see right here, there's actually many. It's a laundry list, but these are just a couple. First off, being more sedentary, there's a consequence of gaining weight, or what we call, and also deconditioning. It's important to exercise to make sure that we're burning calories every single day, to make sure that we're able to walk without getting short out of breath or anything such as that. There's also other consequences such as functional limitations. So what we mean by that is it's important to be physically active, because how many times do we try to pick something up off the floor and something hurts, or you don't have the strength to pick it right back on up, or reaching for something and you can't quite get there because the arm hurts. And so being sedentary doesn't allow the body to move as much as it should. And this creates maybe some pain because you're using parts of your body that you're usually not accustomed to. Also, when you come on into the doctor, a lot of the times we talk about your blood glucose and diabetes and all that. And so one of the most important things, being sedentary, allows for an abnormal glucose metabolism. The A1Cs, as the doctors will talk to you about, are a little bit higher. You need to fix this and change that. Well, being sedentary causes those changes to happen. We'll get to that in a second, more later. In addition, there's also some issues with, muscle atrophy. What does atrophy mean? It just means the muscles are getting smaller. And so obviously not using the muscle tends to, not increase its strength. It's not as big, and then you're unable to use it as much because it's a little bit weaker. Other issues with being sedentary is, osteopenia osteoporosis. What exactly is that? Basically, that's just the weakening of your bones. And so that's why sometimes you see, when you go to the doctor, we do these different types of scans. And it's important, being sedentary doesn't allow, but leads to the bone being a little bit more weaker, a little bit more fragile, by just not doing anything yet, by not putting it to work. Other consequences too also include depression, anxiety, mental health type issues, not being social when we could be social before COVID, not doing activity, being outside, breathing in the fresh air that we all enjoy doing, living in Southern California. And so just being inside the house, not being able to do these things can lead to more depression, anxiety. And as you see at the very bottom point, it's increased mortality risk. And so there's all these studies, and the doctors can tell you, all clinic long, during your appointment, that, it's important to be active, because if not, it increases your mortality risk. And so that was more the risk, but what are the benefits, being physically active? Well, it's almost the flip side. And so it's a protective factor, for cardiovascular disease, stroke, diabetes, and other forms of cancer. And it's important to keep the blood moving through the body, keep the muscles working, causing the, blood or the heart to pump more and more, just to, allow for the oxygenation everything to all your muscles, and get everything moving a little bit more. It also leads to improved mental health. Like I mentioned before, it's the flip side. Being able to be with people, pre-COVID, or even on Zoom, Zoom classes now. It's, being interactive with people, being outside, seeing the birds, being out in the sun. It leads to, improved mental health. Also, there's numerous data and literature about the delay of dementia. Being sedentary, don't do as much, but being physically active, again, the blood's flowing to the brain, you're moving around, and it actually can delay the onset of dementia. One of the most important things about being physically active as well is decreased pain. There's numerous research and studies that suggest, how many, just to think about it, how many people I'm sure that are watching this right now, have pain in their knees, I have osteoarthritis, my knees hurt. Physical activity has actually been shown to decrease that pain. And now it may sound funny, because it's, well, how can I be more active if I have pain? But it's about using the joints, the range of motions we'll get into a little bit later, to actually help decrease the pain and, prevent, like what Dr. Oates talked about before, decrease the need for other medications. But by being physically active, you're using yourself as your own medicine to activity to go change the channel. not being able to, that leads to more, functional independence. And then lastly, improved quality of life. Going over all of these, we have it improved, your improved self-esteem, the mental health, the physical health, all lead to a better quality of life. And so we talked about the, why are we active? Why is it bad to be sedentary? But okay, so, Dr. Mejia, what do we do? What type of exercises can I participate in that actually might, show me benefits? Well, there's 4 of them. You have aerobic or endurance, you have resistance training or strength training, balance training, and then flexibility as well. So first off, aerobic exercise. This is so important for cardiovascular health. Again, like we were talking about, making sure that heart's working just a little bit harder, pumping the blood throughout the body. As you can see here, this gentleman's using the recumbent bicycle. And so this, can do for 10 minutes, 15 minutes, however you see fit. But this is just a form of aerobic exercise. As you all are aware, there's treadmills or walking outside or a brisk walk outside or ellipticals if the knees hurt, can cause pain by walking too far. And so these are all different types of aerobic exercise that have been shown to actually increase, have greater benefit in your health. Secondly, resistance training. And this is a great picture. And so resistance training is super important because it allows for the muscles not to atrophy that we discussed before. Now it's easier to, like I said, to bend down to pick up something or to go up the stairs because you have the strength in your legs. This type, it doesn't necessarily have to be, oh, I have to go to the gym and lift heavy weights. No, that's not what we're saying at all. Resistance training is, very important to help. Right, what we see right here is working on our back musculature, so we have a correct posture, so we're not slouching over and then causing lower back pain. You can use these type of bands for your biceps, your triceps that are behind your arm, and even your legs. And so this is important because as we age, the muscles tend to just naturally regress or become a little bit smaller. We almost lose like 1% or 2%, as we get older. And so the issue with that is, okay, well, yeah, my muscles get smaller, okay, but the loss of strength is actually increased as well. Whereas you're losing way more strength than you can actually see with the loss of musculature. So it's really important to keep up this resistance training to make sure that you keep the muscles strong and you're able to walk and do whatever you like to do. This third aspect is balance. So this is a little picture of Tai Chi, and Dr. Shohan will get into prevention of falls, but this is another aspect of exercise.
We look like we're having a little bit of some Wi-Fi issues with Dr. Mejia. Let's give it a second and see if he comes back.
That is extremely important because lastly is flexibility. And so this is really important too because it allows for greater range of motion type of your joints. And so, some of you, might be sitting in a chair right now and be like, oh, my lower back hurts. I can't, it just really bugs me. Sometimes these type of muscle spasms, if it's in our legs or our lower backs, can be addressed with stretching type of exercises. And so that's why this part is also really important too, to incorporate in physical activity. And so like, okay, Dr. Mejia, all right, you told me all these 4 different things. Well, how much do I do? Like, where do I start? So let's go over some of the, national standards that have been, physicians can tell you about to let you know, okay, where can we start or what's expected of me to maintain a healthy lifestyle and be physically active. And so 150 minutes of moderate intensity aerobic exercise per week. So that breaks down about 5 days of 30 minutes or 75 minutes of vigorous intensity aerobic exercise per week, which breaks down to about 15 minutes per day. And so the next question is, well, what's the difference between moderate and vigorous exercise? Well, moderate exercise is more you can think of as if you're walking with, a close friend right now because of COVID, or a husband or a wife, and your heart rate's beating a little bit higher than you used to, and you're able to talk, but maybe it's a touch harder to talk, but you're exerting yourself just a little bit more. Whereas vigorous intensity exercise, that's where your heart beats beaten. And so you really know that the heart rate's up, and it's a little bit harder to finish sentences as you're exercising. So maybe you can say a phrase or two or a couple sentences, but then you really need to take a breath, like, really take in the oxygen because you're working a little bit harder. So in addition to the aerobic part of physical activity, it's also important to incorporate 2 days of resistance training as well. And that's going back to the picture that we saw, either with bands or light weights. I mean, you can even, if you don't even have bands or light weights, surely, I'm sure you guys, you can go in the kitchen after done with the talk, you can find a couple cans, beans, and just, do light resistance training exercises that way as well. And so usually with the whatever 75 minutes or 150 minutes of aerobic activity, you can do the 2 days of resistance training as well. And we'll kind of see in the upcoming slides about how we can fit all this in. In addition to that, there's also flexibility exercises that are really recommended too after doing this aerobic exercise. And lastly, as you can see the point on the bottom, the balance training is also very important for those that are a little bit more unsteady, maybe those that use a cane to move around. Balance training for 3 or more days if you're at risk for falls. And so what's most important is that if you're one of those people that are listening today and you're like, oh, I feel a little bit unstable or unsteady on my feet, I use a cane, my equilibrium is just a little bit off. The balance training can almost be a foundation for you to build on and then move on to the aerobic exercises and then move into the resistance exercises, because it's really important to have that foundation so that there's, we don't hurt ourselves in the future trying to jump into things too fast. And so this is the slide I wanted to discuss. What does that look like for me? You told me what type of exercises I need to do. You told me how much I need to do. Well, how does this look? And so I just want to briefly go over this chart right here, this image right here, just to give you a quick idea. And so you can, weeks 1 and 2, right? And as you can see on the chart, aerobic activities. So this one says for 3 days a week. So we talked about the frequency, how often we're going to do it. I'm going to walk briskly. So the type of activity and the intensity of the activity for 20 minutes, which is the duration, each day at the local park after dinner. So that kind of sets up a goal right there about what you're going to do, how you're going to do it, and where you're going to do it, and when you're going to do it, and where you're going to do it as well. And so in addition to the aerobic activities, you also see flexibility and training exercises as well. So for the flexibility, for 3 days a week, I'm going to stretch my calves and my thighs, for 5 minutes after I get home from doing my aerobic training. And so this is just taking a couple more minutes out of your day to really focus on stretching those muscles so they're not so tight. If you're walking around, you might be using your lower back muscles, you're using your hamstrings in the back of your leg, your quads that are in the front of your legs. So it's important to find some time to stretch a little bit after using those muscles, especially after you're doing some aerobic activities. And then lastly, resistance training. For 2 days a week, again, frequency, I'm going to lift 5-pound dumbbells. I'm going to do work on my arms and maybe do some arm raises like this, at home at a certain time. And so again, it's kind of setting out that goal for the first 2 weeks. And then you're able to, hit all the aerobic flexibility and resistance training as well. Now, we won't get into weeks 3 and 4, but the idea is as you slowly build up and feel more comfortable, you can start increasing the frequency or increasing the intensity or the duration of the exercises as you guys see fit. No one's saying that you have to jump every week, 1 week, 2 weeks, 3 weeks, increase the intensity significantly. It's as you guys see fit. This is for you guys. Exercise is for each individual person. And so you're not competing against anyone else. It's ultimately just for you. And so I thought this was a great chart to review with everyone here. So this is kind of understanding how we age healthily. And so as you can see here, I want everyone to focus on the curved lines here. You see A with the short little lines, A, B is the long line in the middle, and then C is the longer dashed lines. That's more to the right. And so the basic premise of this diagram or this picture is being physically active allows you to stay in better health, or maybe you fall into the mild deficits, but better health and mild deficits longer. It pushes you to the right as compared if you didn't do anything at all, such as you see with A. And so you see A fall a little bit quicker. You get into those mild deficits at an earlier age, if that's 55, 60, as opposed to being a little bit more, physically active, which is B, which pushes it more to the right. Or if you're doing the guidelines, you just want to stay on top of it, as opposed to C, who's pushed as far right as possible. Now, as you guys can tell, physical activity is not going to cure, it's not going to cure everything. eventually our body starts, as we age, it just slowly is unable to do as much as we used to do. But the idea is if when you're 60, you're trying to stay physically active, the idea is to expand that as long as you can. And so that you can do the things that you love with your family, not only when you're 60 and you're like, oh, my knee hurts, but I can get away with it. No, but it's about when you're 70, 80, and you're doing these exercises and you're still able to enjoy doing family outings, walking on the Strand or going to a national park with family obviously when it's safe. To do those things when you're a little bit older because you've been being physically active for the majority of your life. And so we talked about what types of exercises, how long we should do it. And so the next aspect we want to talk about is how do we build this into the routine? Like, how do I do this? Sounds really overwhelming. You told me aerobic exercise, resistance exercise, stretching, balance. I don't know what to do. And so what the most important thing is, what we discussed is, let's set goals. And goals are the most important thing that we can do to get better health outcomes, because we're writing out on a piece of paper. So everyone's sitting in the chair right now as you're home, maybe with, you have your significant other next to you, just kind of close your eyes. Think about, what's my goal? What do I want to do if, let's start goal set on Sunday, tomorrow. And what do I want to do for the next week? If I, is it a 5-minute walk to start off because I don't do much before? That's great. And so it's the important parts to set goals and write them out, so that then that Tuesday, well, okay, right now is my time to walk. And, I kind of don't want to, but you know what? We set my goal. This is what I'm going to do. And then the next thing is, let's perform activities that are reasonable. And we're not asking you to, no one's asking you to run a marathon or, swim 5 miles in the water. What's most important is to make sure that you can do that 5-minute walk at first and then slowly build up from there. The next part, build in structured and unstructured exercise. Dr. Mejia, I hate going to classes. They're not for me pre-COVID, obviously, or I don't like Zoom classes now that we're in COVID. Fine, let's try some unstructured exercise. What's that mean? That's mean like, oh, you can enjoy gardening? Well, go garden. If that's, okay, well, I don't like actually walking just to exercise. You know what that means? When you're at the grocery store next time, park a little bit farther in the back. And, if you're able to, walk that entire distance to the front of the store. If you live in a 2-story building or a house, it's climbing up those stairs, and you do it once, you go back down, get whatever you need to do, but doing it again 2 or 3 times. Just kind of, being more unstructured. You don't have to go anywhere to do it. You're just kind of doing it naturally. And like, as I mentioned before, plan to increase your exercise capacity. And so that's kind of like the diagram that we saw before. So weeks 1 and 2, you did X, Y, and Z, and then, or ABC. And then the next 3s and 4, as you see fit, or like, okay, I'm getting used to this, then it's X, Y, Z. So we kind of building it up so then it doesn't allow our body to get used to things. And then lastly, we can perform bouts of exercise. Oh, I don't want to do 30 minutes of exercise. That's a long time. That's too much for me. Or I don't have the time. I have too many things I'm doing. I don't know if that's too much the case right now, but performing bouts of exercise is also important. It's been shown that it's almost just as good as doing 30 minutes straight, or maybe even better. And so bouts of exercise more includes, okay, I'm gonna do 10 minutes in the morning of a walk, maybe, 5-10-minute, walk, at lunchtime after lunch, and maybe 10 minutes later into the day. It's about spacing it out so that you can fit in the 30 minutes of moderate aerobic activity, or, if it's vigorous and you're combining the two, then splitting it in 2 times a day, just so it allows your body to recover. So as we come to a close here, so you told me all this stuff, right? Can I talk to anyone? Is there resources out here where, someone may be able to help me, or I can, at least work out with be physically active with other people? Of course there are. And as you can see here, there's 2 examples right here. And this is just from areas, wellness centers locally. We have a calendar here in October, of this month. And so as you can see here, it's kind of a small font, I apologize. But again, it's exercise class with so-and-so on this date at this time, or Tai Chi, the balancing exercises that we talked about on October 13th at such time, or Zumba classes, dancing classes, where we don't even think it as an exercise. It's fun, Actually, physical activity can be fun. It's not meant to be draining and boring and, oh, I hate this. I'm just doing it because I need to, because my doctor's telling me. These things can be fun even at your own home when we're in COVID. And then on the right, you can see there's also information within these websites about different types of exercises. And so, as I need to mention, of course, that it's always important to talk to your doctor before starting a program or starting to do, as you see here, a gentleman trying to do squats on the chair. or in leg raise, it's always important to talk to your doctor to make sure that you have the right foundation set. But these are diagrams, or these are pictures that are out there within Manhattan Beach, within Hermosa Beach, Redondo Beach, the PV area. There's numerous information that you can easily find that kind of gives you exercises such as these. And so with that, I really appreciate you guys' time. I hope you got something a little bit out of there. And again, it's just really important to stay, to just set those goals and to start off somewhere, because we want to, have a very happy and healthy life, not only when we're 60, 65, but as we age till 70, 80, and 90. Thank you so much, everyone, for your time. And now I want to introduce Dr. Chauhan, and she'll be the next lecturer. Let's see here.
Okay, good afternoon, everyone. I am Hardeep Chauhan, and I don't think I am unmuted, actually. Let's see here. Okay, it's fine. I joined TMPN about 2 to 3 months ago. Really happy to be here with all of you today. And I'm at the Manhattan Beach branch. Especially happy to be talking to all of you because before Torrance, I was at Eisenhower Health, which is in Rancho Mirage, as many of you know, and a huge retirement community there. And that's why, treating and taking care of elderly is one of my passions. So here we go. I think this presentation will sort of bring the other two presentations to a nice conclusion by Dr. Ruhi and by Dr. Mejia. So the first thing I would like to start with is the facts regarding falls. Just to kind of give you a perspective how big or small of a problem this is. And it is a big problem because, we are aging as a population, which, comes with its own kind of physiological changes, and hence the falls and so on are increasing. So looking at the numbers, this data is from 2015, there were 3 million elderly patients that were treated in our ERs. Out of those 3 million, 800,000 had to be admitted to the hospital, most likely for a fracture or a brain injury. And when you bring into perspective, how many of us or older population is on blood thinners for AFib, for arrhythmia, for other things, then it just, puts you at higher risk for bleeds. Brain bleeds, the most serious of all, And so 800,000 were admitted to the hospitals. Of those, 300,000 were actually hospitalized for hip fractures. And that's a huge thing because a hip fracture can really change a person's life. You could be an independent dwelling adult and all of a sudden you have hip fracture and, unable to take care of yourself, unable to live independently after that, maybe have to move to a living, assisted living facility and so on. Hip fractures in elderly is one of the most debilitating and life-changing things that can happen. So very important to prevent that. And to look at the cost of this whole issue, $50 billion in 2015 from falls. Again, looking at numbers here, our population is aging and that's why fall numbers are increasing as well. Again, these are a few predictions moving forward. 2018, we'll have about, we had about 52 million people over the age of 65 and 8 million injuries were predicted. And for 2030, 73 million elderly and 12 million injuries, predicted. Dr. Ruhi touched on this, Dr. Mejia touched on this, that what's happening as you age, many different things. So let's start from top. So your visual acuity, your depth perception, not able to see the contrast as well anymore. Actually, many studies have shown that wearing progressive lenses, multifocals and trifocals, also actually puts you at risk for falls, just because as we age, we are not able to sort of adjust to those changes as fast as one needs to prevent falls. Also, there is a change in muscle activation patterns. So you're not activating muscles as fast as you need to when you're changing positions, say from sitting to standing up, but also you might not be activating the same muscles that you did when you were younger. When we are younger, we can and we do activate our distal muscles in our inner feet and our legs to quickly stand up. As we age, we are mostly engaging our proximal muscles first, our quads first, so that changes. Then other thing that happens is our total body water percentage and muscle percentage sort of declines with age. So, and that again puts you at risk for having low blood pressure and other issues from that, including falls. And then again, balance issues, lower baroreceptor response that Dr. Ruhi talked about, gait stability, all those things put you at a higher risk. So, she talked a little bit about postural hypotension or orthostatic hypotension. Let's get into it a little bit more, because by far, I think this is one of the most biggest culprits I see responsible for falls. What that means, postural hypertension, is that when you're standing up, when you're from sitting down, from laying down, all of a sudden you feel your blood pressure doesn't adjust equally as it needs to. And then you feel a variety of symptoms. So these are the various symptoms one can feel: dizzy, lightheaded, sensation that you're almost passing out, headache, some people get that, or just feeling fatigued or weak throughout your day, more so than you think you should be. Many times this is a symptom of having low blood pressures throughout the day. So CDC has this campaign called Steady, which is essentially geared towards preventing falls, and it's based on 4 pillars essentially. Number 1 is to speak up, meaning that when you go to see your primary care doctors, you bring up these issues that, doctor, I had this episode where, where when I get up, I feel lightheaded. Happens all the time, or happens a few times, you bring it up. You take note of these things that I was feeling lightheaded. Why, bring these up. They should be asking you as well when you go in for your annual exams and so on. Hey, did you have any falls this year or in the last few weeks or anything? But please do make note of it and bring it up, because that is not normal and should not be happening. Next thing is keep moving, keep yourselves active, as Dr. Mejia was talking about. That's the most important thing you can do. Number 3 is making sure your eyes and your eyewear that you're wearing is up to date with what you need. So definitely get those eyes checked every year, so that we're catching cataracts or vision changes and all those things early. And lastly, make your home safer. So let's talk about it a little bit more. So the first point I spoke about was talking to your doctor, bringing it up, and reviewing your medications with them to making sure that none of them are causing as a cumulative effect that you might be getting dizzy from them, sleepy from them, or your blood pressures is being lowered too much, more than that's necessary because of the medications. So, polypharmacy, very, very important. The other thing that studies have shown is vitamin D supplementation, that it helps in preventing falls. So, as part of your yearly exam, I'm sure your vitamin D's levels are checked. So keeping them in a good range, 30 to 50 is a good idea for a variety of reasons, keeping your bones strong, which in turn leads to lower fall rates and bad consequences if you do have a fall. Then the second thing, going in line with keeping active, strength and balance exercises. That's what I would focus on. I know Dr. Maya talked about all the others. So Tai Chi. It's hugely effective in improving balance. It's something you can maybe look up online, try it in your living room first, and then I think a better location will be out in a garden or a park or by the beach, with your friends, with enough distance between you all, of course. And then you can do these exercises. They're just kind of standing movements that help in improving your balance. Number 3, getting your eyes checked like we talked about. And then 4, making your home safer. So essentially just doing a survey of your house, making sure there aren't, places where you can easily trip, no wires, obviously, no rugs that are getting, accumulated or things like that. And the other important one I would like to bring up is in your showers. So again, when you're, in the shower, water is hot, that can bring your blood pressure down along with all the other factors we talked about. But that's a risky situation that a lot of people do find themselves in, that while they're showering, coming out, they were lightheaded, So you need something there in those times that you don't lose your balance and fall. So having grab bars inside, outside the showers and tubs, very important. Making sure if you have multi-story homes that there's rails to your stairs, that's something to keep you steady. And lastly, making sure that everything is well lit. Again, a huge problem or a big problem at night because you're waking up to go to the bathroom, and then making sure that there's enough clear passage to the bathroom when you go at night. So essentially common sense things, but it's nice to get these done and checking this off every so often so that we don't have these falling hazards around the house. Oh, my slide doesn't want to go ahead.
Dr. Chauhan, if you hover down at the bottom, oh, there you go.
Yeah, I think it just happened. Okay. So again, these are a few medications that Dr. Ruhi also spoke about, which are the main sort of the big players that can cause falls or cause dizziness, cause excessive, lowering of blood pressure when they all combine together. So benzodiazepines, your Xanax, your lorazepam, all those things, your opioids, so Norco and things like that, that you were maybe taking for severe pain. And then other anticonvulsants, antidepressants, a variety of drugs. Essentially, your primary care physician should be keeping a check of all of these, making sure there aren't interactions happening that shouldn't be, and the dosing is adjusted to your age. Once again, keeping active, keep moving is one of the biggest things that you can do for yourself to prevent a fall in future. And this is a simple exercise here. Oh, I think the pictures are getting covered, but it's exercise that you can do at home. Essentially, it is a step-by-step movement where you sit at the edge of a chair, hold it for stability, and then move up and to standing position slowly in 3 gradual steps, and repeat this movement and slowly do it so that you don't need to have the support of anything for help, that you are able to independently, without having any support or touching anything, you're able to gradually rise up and stand, and then sit back down and then stand. Do that multiple times. That is also really good for strengthening your muscles and also improving your balance. So yes, in a nutshell, falls are preventable. They are a big problem, but they are preventable. And we should all be working together as physicians, as all of you as patients, so that we don't end up in that situation, because honestly, it can be life-changing for many. Thank you. It was really nice to speak to all of you, and I look forward to questions. I will give it over to Janet now.
Hello, sorry about that. Give me a sec. Hey, thanks. Thank you everyone for joining us. We have a few questions that came up from Marcia. I hope I'm saying that correctly. This one's for Dr. Ruhi. With thyroid medication, does it change how it works when patients turn 70?
Sure. Actually, that's a very good question. Can you hear me?
Yes.
Okay, very good question about thyroid medication. As I discussed before, so when you age, you're aging, your kidney function and liver function is decreasing. So it takes more time for, the medication that you're taking to excrete and remains in your body longer. So sometimes, and body will be more sensitive to the medication, especially for thyroid medication. Sometimes the dose needs to be adjusted for a couple of reasons. One of them was because your kidney function has changed. One of them is because your body, for example, you started having palpitation, heart racing, and not all the doctors, especially subspecialized, don't have the time to go over all your medication. So they add another medication to suppress your heart rate. But sometimes because kidney function is not good, liver function is not good, the thyroid medication that you used to take and it was okay for you, all of a sudden now is too much for your body. So it's better to be adjusted. And then one more important thing about thyroid medication is it's better always to be taken separately from other medication that you are on, because there are a lot of interaction, especially for absorption of thyroid medication. So it's always good to take in like half an hour far from other medication that you are taking. I hope I answered your question.
Thank you. Yeah, absolutely. The next one is for Dr. Ruhi again. There seems to be a confusion whether taking a generic medication versus a brand name. Do you have any tips, recommendations, or anything to say about that?
This is really not different about elderly population, but in general, some people have different reaction or response to like generic medication versus like brand medications. So it's not basically just for elderly or, it's different from person to person. It's not about the age.
Okay, thank you.
Sure.
Dr. Mejia.
Yes.
What do you think about red light therapy?
There can be some, yeah, if it can work for some people, it can work for other people. Sometimes what people, they may experience benefits of it. But at the end of the day, sometimes the literature isn't there regarding, if it's been shown to be significantly different than just doing other physical activity. And so, I mean, if it works for people, just like some other medications, generic versus brand name, like we already discussed, that's okay to do. But we would like to just see, we like to, when we're in the office with our patients, just really focus on, where the significant part of the evidence is in regards to physical activity and exercise. So nothing particularly wrong with it. It's just something that, when I speak to patients in clinic, I kind of just go back to the basics, stuff that we can really focus on that has been shown to work, through all ages. And so, just like, we kind of go a little bit off topic too, with supplements and all that type of stuff, is supplements and vitamins. And so sometimes those things aren't necessarily regulated by the FDA, but it doesn't mean they're necessarily bad. It's just something good to know that you're doing in addition to other, physical activities. Hope that answers the question.
Thank you. I have another one for Dr. Mejia from
Mm-hmm.
Linda. How long do we have to exercise to get your heart to start pumping, to start burning calories?
Oh, just seconds, minutes. It's that first step out of your door. Anything that pushes you just a little bit beyond your normal threshold, if that's, if you're walking around a lot and, your body is used to it, it may be that additional extra 2 cents of intensity there, the extra, the duration may be a little bit longer. And so that's a great question. It's like, well, what do I need to do to really just make sure that I'm burning calories? Anything you do is better than sitting down or better than just kind of laying around. And so just doing that walk, I mean, just to start out, many of you already do those type of things. And so just doing that is burning calories. A lot of you do a great job doing it. This is just about optimizing and doing as best as we can. And so there's nothing per se like, oh, you need to do exactly 1, 2, and 3. It's more just let's just get you outside. And as you start walking, the heart rate goes a little bit faster. And what I tell a lot of patients too is, okay, if you've done that for a number of years, it's also really important to, just like I mentioned before, increase the frequency, intensity, the duration, or the setting of where you do it. And so if you're walking in a certain park and you kind of walk in a square, you kind of pass, there's a hill, and it can be hilly around here in South Bay a little bit. You kind of pass that hill, like, okay, I got my walk. Now try going up the hill. That's going to burn a couple extra calories. That's going to get your heart rate going. Now, of course, that goes without saying that, be sure that you can tolerate those type of things first. So it may not be going up the whole hill, it might be going up, a quarter of the hill first. And so that's just a great question. Anything's better than nothing, but increasing the time, the intensity, or where you're doing these exercises also plays a part in, helping you to increase your heart rate and burn calories.
Thank you.
Mm-hmm.
I have a question from Sharon. I'm going to leave it to the open floor because I'm not quite sure who it's to, but does sunscreen prevent the absorption of vitamin D when we're out in the sun?
I can take this one. So actually studies have shown that it does not interfere in absorption. So if you are putting sunscreens, it doesn't prevent from your body from making vitamin D. But what does change as we age is our ability to change, to make active vitamin from the sunlight via our skin. So that's why many times as we age, we do need that extra vitamin D, even though we spend some time in the sun, because our skin's quite not making it like it used to.
Thank you. Dr. Mejia, I believe this might be for you. Is it safe to be in a water aerobic class in this time of COVID?
And so that's actually a great question. And so now we're starting to see some of the pools are opening up. Those spots are opening up right on Monday morning at 8 o'clock, and you got to sign on in and get in as fast as you can. And so, the recommendation is if you're able to do water aerobics and you're spread out amongst people and you're outside, you're trying to keep, maybe 6 feet, probably even more. I don't think it would be a horrible thing to do some water aerobics. A lot of the pools are starting to open, and they have a lot of protocols in place. Given if you're not immunocompromised, you're not taking any medications, that could cause you to get the higher risk. There really shouldn't be. Just keep your distance. I don't want to say there shouldn't be a worry, but just keep your distance and start doing the water aerobics. That's a great point. I didn't even mention in my talk is not even the land-based exercises, but the water aerobics. So again, just to summarize, it's just important to keep your distance. Make sure it's outside. I'm assuming all the pools out here outside. There's really no indoor one I can think of. But yeah, that's a great way to reduce the knee pain or knee burden and burden on joints altogether. Good question.
Thank you. I have time for 2 more questions. Dr. Mejia, from Anonymous, I do the same exercises every day, approximately 84 minutes. Is this good to keep up, or should I make changes?
And so I understood the question is you do the same exercises for 84 minutes. And so, yeah, first off, that's wonderful that you're doing it for 84 minutes. For everyone else that's on there, don't worry, you don't have to do 84 minutes. It's okay. And so, what we like to do is, what we call, when we work with, athletes or the importance is to cross train too. And so is it bad to do it all the time? No, not bad. Your body's used to it. But you want to try to change it up every once in a while, change it up a little bit to just optimize your physical activity. And so, like I mentioned before, and so maybe it doesn't necessarily need to be 84 minutes of activity that day. Maybe it can be a little bit of a higher intensity, so you actually shorten the amount of time, the duration that you're exercising, but the output of the energy that you're using actually burns the same amount of calories. So again, not bad that you're doing the same thing. You just want to make sure you just want to watch out. You're not, what we call in sports medicine overtraining, or if you want to make sure that your body has some breaks as well. That's great. But there's other ways to do different types of exercises that incorporate the same muscle groups that also include cardiovascular exercise as well. And so that's something to think about. Hills, like we just talked about, water aerobics, in addition to what you're already doing. So very good question. You're doing great. But yeah, there's some changes that can be made to optimize physical activity and burning of calories and making sure we optimize your health.
For our last question, I'm going to leave it to the open floor. can bone loss be reversed?
Someone wants to,
Anyone?
I can take this one. And so it's, so can it be entirely reversed where you're back to 20, where you're like 20 years old? Let's say it's someone who's 55, 65, and already showing signs of osteopenia or, osteoporosis. Can it be completely reversed? No. But the idea is to continue to do these type of exercises so that it can, allow the bone to resorb and as much as it can to become a little bit stronger. And so that's why we have, there's, as many of you know, when you go to the doctor, oh, you're osteopenic or you're osteoporotic. Yeah, let's start some medication. You can do the medication in addition to physical activity as well, which helps improve the bone matrix. But yeah, it doesn't cure it altogether. That's a really good question. And so that goes back to that graph we were showing. It doesn't bring everything back, it doesn't bring everything to the right where it's a flat line and you're in perfect health all our lives, but it helps slow the rate of loss in the bones. So that's a really good question.
Thank you. So just to wrap it up, I want to thank everyone again for being here today. I want to thank our panelists for their time and making sure today was made possible. Apologize for all the Wi-Fi issues. We do the best we can with what we have. Our contact information, if you want to learn more about us or learn more about our panelists that spoke here today, please give us a call or visit our website. I know I missed a few questions, so feel free to reach out to us this way as well. Thank you and enjoy the rest of your weekend. Julie, if you have any final words.
We're good. Thank you all for joining us. Appreciate your time and energy. We will take this and try to make it a little bit better for you. But anyway, have a great rest of your day.